Good morning. As Dr. McGall said, I've been asked here today to give my perspective as a patient of living with X-linked hyperphosphatemia. I thought I would start and try to cover three main areas: growing up, next generation, passing it on, and continuing issues with growing older. So growing up, I'm going to give some recollections of diagnosis, treatment, family life, and the corrective surgery that I've had. I was born in 1958, don't say it too loudly, at Westminster Hospital in London. My father was in the Household Cavalry then, and he was born and raised in Tolworth, Surrey. My mother was at that time a housewife, and she was born and raised in Cheam, Surrey. So we came from that part of the world. And at that time, I had an elder brother who was 2.5, and he wasn't affected at all. It wasn't until I started walking, about the age of 13 months, that my parents noticed that I waddled a bit and my legs were slightly bowed. So being a bit concerned, they spoke to the doctor and he referred me back to the paediatrician at Westminster Hospital. He suggested that my parents put some wedges in my shoes to help my gait, but these didn't seem to help at all. So they went back to him, and he then referred me to the paediatrician at Westminster Hospital, and then they referred me on to the Royal National Orthopaedic Hospital in Great Portland Street, to a Dr. Nassim there, who was a very friendly. He recognised the problem and diagnosed vitamin D resistant rickets, which was quite unusual at that time. They thought it had sort of died out. My parents aren't sure when the diagnosis of X-linked hyperphosphatemia was made. My father seemed to think it was quite some time later. Anyway, they couldn't trace it back to either parents, but it was thought to be influenced from my maternal heritage, as my mother, later in life, after she was about 70, she did suffer from some bowing of her legs. So they thought it might have come from her. Sadly, she died in 2013 from a sudden heart attack, so I've not been able to corroborate any of my recollections with her. So we just have to take them as my father and I have tried to recall. So that's Great Portland Street. And as you can see, I was not always a very compliant child. Regular medication of phosphate and calcium was obviously going to be very difficult. But I have to say, in other regards, I don't know if you get my drift, I was very compliant. Not so my children, I think, but there you go. However, at the age of 3, there was evidence of slight bowing of the tibia. In 1962, age 4, my father was posted to Germany, and we moved to Hereford, Westphalia. I can't actually recollect any hospital consultations, but I do remember making regular trips to a hospital in Rintown. I know this because my mother got this fantastic collection of glass-blown animals from a glassblower next to the hospital, so I reckon I must have gone there. Whilst in Germany, my mother went on to have 2 more children, another boy and another girl, neither of whom had my condition, so I was one of a kind. As you can see, still at the age of 5, my legs actually look quite straight. And they talk about dental problems. Well, this is me age 6. I didn't really have many dental problems. I think the deformity of my teeth at the front was actually from me sucking my thumb, to the extent that my father was so exasperated, he covered my thumb in a mustard-covered plaster. That seemed to do the trick, and I didn't suck it anymore. So, there we are. I can remember having to have several fillings and root canal treatments throughout my adolescence. So still at the age of 7, you can see my legs are actually still quite straight. I must have been taking the medication, though I actually can't remember it. So in 1966, we left Germany. That's me, my mum, my elder brother, and my 2 younger siblings. And we came back to the UK, and we settled in Windsor. So this is me now, aged 8. You can actually see the bowing's actually becoming a little more obvious. So I well remember then making regular trips up to Great Portland Street and Royal National Orthopaedic Hospital, where I saw Dr. Nassim, and a nemesis of a dietitian called Miss Hill. She used to instill fear in me. She always chastised me for being overweight. I said it ran in the family. But I just looked at her, I thought, oh, you really could do with taking some of your own advice, because she wasn't the lightest of people. So anyway, this I found on the internet. This is the outpatients clinic at Royal National Orthopaedic, and I remember it so well because it had fantastic murals on the walls. They were hand-painted, and they were stunning. And this room here was where I saw Dr. Nassim, and this one next door, the dreaded Miss Hill. Still fills me with dread. I remember having to go for regular x-rays of my knees, and it was probably these visits that actually prompted me in later life to train as a radiographer. Well, I think it was. But I discounted nursing and various other things because of various reasons, so radiography was great. I also remember waiting outside the pharmacy there for my huge bag of phosphate powders. They came in powder form then. You used to get bags of them. I'd go back to Windsor with bags of calcium and phosphate powders. My mum used to dissolve the powders in Bovril to begin with. It was disgusting. But she thought it would disguise the taste. But then I think she recognised that I didn't really like taking them, so then she tried orange squash, but still, they tasted awful. So she was initially very good at making sure that I took the medicines, but, if I could avoid it, I would, basically. I didn't realise the good it was going to be doing me. So, aged 11, you can see my bones becoming more pronounced. However, it never stopped me from doing anything, although I wasn't the fastest runner behind helping these ponies go along. My family were well into horses, and my father and brother drove them, but I just enjoyed riding them. So that was it. I was always quite active as a child. I used to ride my bike a few miles to and from my high school every day, and I was even goalkeeper for the hockey team for a while. So as years went by, the bowing worsened, probably because I wasn't taking the phosphate that was prescribed. I actually remember having a huge stockpile of powders on the kitchen cabinets in Windsor. And before I went off to college in 1976, my mother insisted I got rid of them. Get rid of all this. And I thought, OK. So I spent a whole afternoon tearing them all open and dissolving them in a bucket of water. It took ages. Sadly, I should have taken all those. So anyway, by the age of 16, my legs were extremely bowed, and Dr. Nassim referred me to an orthopaedic surgeon who carried out osteotomies. These operations were carried out at the Royal National Orthopaedic Hospital in London, and I woke from the op to find my leg in plaster from groin to ankle. Following the first stop, I acquired quite a bad infection in my leg, and I remember them coming to cut a window in the plaster and then cutting it free a couple of stitches, at which stage this huge amount of pus came out. It wasn't very nice. It was a really hot summer, I remember, and I had to have a fan at my bedside and regular sort of cool sponge baths. I actually thought I was going to die. I felt that bad. And this was confirmed to me when they came along and said, we're sending you off to the country. I was like, what? So I remember going down in the ambulance from the Royal National Orthopaedic site in London to the Stanmore Middlesex site, where they were sending me to an isolation ward. And I was really upset. I said to my mum, are they sending me off because they don't want me to die on a public ward? It was quite traumatic. I seemed to spend several weeks there. I had my own room, which was really great, and doors that opened onto the garden. But I used to get chastised by the matron because I would encourage the squirrels to come into my room, and she wasn't best pleased. I would feed them scraps. I had the plaster cast on for about 6 weeks each time, as you can see, from my ankles up to my thigh. And then I had to go for physiotherapy. I missed the first few months of my A-level course through the surgery, so I just concentrated on 2, which was enough to get me into radiography, which is what I wanted to do at that stage. Having qualified as a radiographer, I went to work at the Kent and Sussex Hospital in Kent. And then in 1982, I went to work in Johannesburg. Sorry about the slide. It was taken from the front of a scrapbook. That's all I could find for that. Joburg. I went all that way to meet my husband, who was actually from Scotland. But there you are. That's fate for you. In my second year in Johannesburg, I moved jobs from Hillbrow to a Rosebank clinic, which is actually an orthopaedic clinic. It's not the size that it is now if you look it up on the internet. It was just quite a small clinic at the time. But I met a surgeon there called Mr. Burson, and we chatted about my condition, and he was quite interested. And he said, you know what, I could really improve your legs if I did some femoral osteotomies. So he did this with tibial tuberosity surgery as well. So he put these plates in, cut the bone, put the plates in. And again, I had my leg, entire thing in plaster, but out there I was able to sun myself, which was great. It did leave them a lot straighter, I have to say, but I do have a lot of scars, so ups and downs. He was pleased with the outcome at least, so I was really as well. In 1985, my husband and I returned from South Africa and we got married and settled in Marple. So then it was time for the next generation. So in this regard, I'm just going to give some insight into diagnosis, genetic testing, family life, schooling, and the surgery that they had to undergo. In 1986, I became pregnant with a daughter. And during the antenatal visits, I would raise the subject about X-linked hypophosphatemia. And I don't think anybody really knew what I was on about, to be honest. Because they said, no, you're fine, it'll be fine, we'll just carry on, it'll be fine. So I didn't really, push the subject. So in 1987, my daughter was born, normal birth, and she was fine. Although I was concerned she might have the condition, nothing was done about testing her. And even though she was referred to an orthopaedic surgeon at the age of 9 months because she was found to have clicking hips, he never did anything. The surgeon just wanted to put her in a fog plaster, you know how they are. But we were imminently going to go back to South Africa for a holiday. So I was like mortified. Oh, I can't take her all that way in a plaster cast when we were going to be sunning ourselves and in and out pools and whatever. So they actually made a frame for her, which sat over her shoulders and then went round her legs to abductor femora. So I sat on the plane 16 hours with her in this frame as we flew to South Africa. But it was great. It did the trick. And it stayed on for about 8 weeks, that frame, and she was fine. I can't remember exactly when she started walking, and I don't really think I had any concerns. So in 1989, I gave birth to my son, Stuart. By this stage, at the age of 2, Claire's legs were actually showing quite a degree of bowing. So I badgered the consultant and said, look, please, will you just test them both? I think she might have it. I'm concerned Stuart might have it. So he relented. He said, all right, we'll send you for x-rays. And lo and behold, he sent them for x-rays, and it was diagnosed by Dr. Mughal, who he then referred us to as X-linked hypophosphatemia at last. Thank you very much. I can't quite recall when I started with phosphate again. I was referred to Dr. Mike Davis at MRI, a colleague of Dr. Selby's. And then he put me back on the phosphate and the calcium as I showed evidence of these leucosomes in my hips. So that's when I started back on my treatment. Having had 2 children, both with hypophosphatemia, I was asked if I would take part in some genetic testing. So I decided, yeah, okay, why not? Somebody's got to do it along the line. So I was quite keen to establish whether any future pregnancies would result in my children having the condition. Seeing as how I'd got 2 out of 2, was that, going to happen? Or was there a possibility of having one without the condition? So I went through the testing. They were looking, obviously, at the X chromosomes. And they came and decided it was actually only on one of my X chromosomes. So there was a 50% chance of another child having hyperphosphatemia. So they also talked at that time about coming up with an in vitro test. Well, I just said I wouldn't be interested. I didn't consider it was a serious enough condition to be tested in vitro. So, and I certainly would never have terminated a pregnancy if it had come back positive. I don't know where that led. I don't know if it led anywhere. But I went on to have a third child in 1992. And after testing by Dr. McGall, he was diagnosed with hyperphosphatemia. So I'd hit the jackpot, 3 out of 3. But anyway, at least they were all the same, so I treated them all the same. Interestingly enough, I actually had 2 miscarriages in between the first and second and the second and third. And I've always sort of thought, well, is that because he had the other X chromosome? Was there a defect on the other X chromosome? But unfortunately, that has never been investigated, so I'm still none the wiser. Family life. Well, 3 children now with hyperphosphatemia. Family life revolved around medication, schooling, hospital visits, and then corrective surgery. I had given up work when I had Claire because my family lived in Scotland, as my husband's family lived in Scotland, and we didn't have any close family roundabout. My husband, he was self-employed, so he just had to work to financially support us. So I was left really to myself to sort out the children's needs. Children's medication, well, as you've heard today, it involves 1 alpha drops in the morning. Now, that's the easy part. Well, that was the easier part. Then phosphate Sandoz. Now, they were asked to have it 6 times a day at that stage, which was quite a feat. But I sort of determined that they'd have 1 at breakfast. This is half a tablet dissolved in cordial. Half at midday, half at lunchtime, half in mid-afternoon, half at tea time and half at bedtime. That was the ideal. That was what I sort of tried to get them to have. Which wasn't too bad if you were at home all the time. But obviously, if you were out and about, it was really quite a feat to try and get these tablets down them. But knowing how important it was and my missed opportunities with not taking the phosphate, I was quite sort of determined that they should take it as much rigorously as possible. So all the children attended Rose Hill Primary School, and they were tremendous. The staff there were brilliant. And they were diligent in ensuring that the children had their regular doses 3 times a day. These are my 3 children now. So they would go to the office. I supplied the school with the phosphate Sandoz tablets and a bottle of cordial, and they would make up the cordial, put the tablets in, and give it to the children at the appropriate times. They were great. They were also very mindful of the physical limitations. Although I have to say, the children participated in sports events, and they did everything pretty much as normal, and they had very positive attitudes. Hopefully, I'd been a bit of an example to them with carrying on with life as normal. Following on from primary school, they all attended Marple Hall Secondary School. Both schools are within a few minutes' walk from our house, so they would walk every day to and from, which is great because nowadays they seem to put the children in the car and take them a few hundred yards up the road. But no, my kids walked every day to and from school. All the staff at the secondary school were mindful of the children's conditions. However, it was left to the children themselves to take their phosphate, which wasn't tremendously helpful. So I used to send them off with a bottle of cordial with about 1.5 tablets dissolved in it and say, drink it throughout the day. I sort of figured if they could get that down between when they went to school and when they came home, it wasn't too bad a feat. I'm not sure it happened, but anyway, what can I say? Again, the physical limitations didn't really prevent them from participating fully in activities. Stuart, he played rugby for the school. For the first couple of years he was there, until the pace got a bit too quick for him. And Alistair, he loved playing basketball. So the schooling was nevertheless interrupted by the regular hospital visits. Luckily, I had car transport, so the hospital visits weren't too much of a problem. The condition and medication required regular monitoring. As you've been told, it was blood tests, urine tests, x-rays, and ultrasound scans. I had to take them to see Dr. McGall at St Mary's, and that was every 6 months. And then in between times, we had an arrangement where I would just take them locally to see a really nice paediatrician called Ruth Jameson at Stepping Hill. She was brilliant. She used to take the children's blood herself. Fortunately, they weren't needle phobic, and initially they would have Emla cream on, but they got so resilient that they just used to say, just get on with it, you know, no problem. Regular urine collections were okay, but they weren't brilliantly easy until they were potty trained. I suspect some of you have found this out. It's not great to try and get urine from a baby and a toddler. Fortunately, my children were quite well behaved, and it was helped by the fact that I went back to work as a part-time radiographer at the Alexandra Hospital, so I worked with Dr. Russell and Dr. Rimmer, who were the radiologists who did their renal ultrasound scans. So when they went to St Mary's to have these scans, it was really quite a friendly and relaxed atmosphere, so the kids were great. Hyperphosphatemia, as is said, can result in dental problems. And when these occurred, my children went up to the dental hospital in Manchester. And throughout their growing up, we've all had to have various root canal treatments. Sadly, Stuart, who's my eldest son, his has been more severe, and he's had to have quite a few dental implants. But still, he carries on brilliantly. Round in the 1990s, my two elder children were asked to take part in a clinical trial at that time. This meant staying overnight in hospital and having bloods taken. And then they were given an intramuscular injection of growth hormone, I think they used at that time. I'm not quite sure of the outcome, but they were brilliant and endured the whole process in their usual good humour. In order to correct both Stuart's and Alistair's bowed lower limbs, they were referred to an orthopaedic surgeon at Booth Hall. This is a picture from the past, because it no longer exists. I think it's a housing estate now, but it was a lovely hospital. And Stuart's surgery was carried out by Mr. Day. He was a lovely surgeon. And subsequently, Alistair's was carried out by Mr. Zenios. As I had, they both went and had tibial osteotomies, but surgery had moved on since my day. And instead of the plaster, they had their legs put into one of these. It's not terribly sharp. It's a Taylor spatial frame. And this involves pins going through the broken bone, and then you can adjust the things on the outside to realign the bones. So they endured these, which they did brilliantly, I have to say. They spent a couple of weeks on the ward post-op, getting used to it, and then they had to come home. And the most inconvenient thing about them, I guess, was having to clean around the pin sites daily. They were really diligent about this, I have to say, which was great. But even so, they did actually get quite a few infections, so they were on antibiotics quite a lot. Claire's legs, my daughter, didn't bow as much, not as affected. However, her one leg stayed straight, but as she grew, the other one sort of went a bit knock-kneed, so she's actually got K-legs. She has declined surgery and actually hasn't taken medication since leaving school. But what can you do? She turns sort of adult, and you have to leave them to their own devices. So my hands are tied. Anyway, those are my children, and then we move on to the next generation, my grandchildren. Claire, my darling daughter, 2004, she gave birth to my grandson. And he, unfortunately, was given the affected X chromosome. So he was diagnosed almost after birth, because she was still seeing Dr. McGall, with the deficient chromosome, passed on from me to Claire and then on to Jacob. He's been treated early with phosphate and 1-alpha. as his mum had done, and she was taking him to regular hospital visits. He's been great. He really has been great. Not minding the blood tests. I don't think he ever really had Emla cream. He just says, look, get on with it. He's got a brilliant positive attitude, and he enjoys sports, even though he has quite a severe bowing of his lower limbs. At the age of 3, unfortunately, he developed quite large dental abscesses. So again, from the dental hospital, they decided to remove all his baby teeth, which seemed a bit drastic, but he coped. And subsequently it allowed his adult teeth to grow. And really, I don't think he's had many dental problems since. So that was great. Claire subsequently had 2 girls, neither of whom had the affected X chromosome. So, like myself, Jacob was one affected child with unaffected siblings. And this can be quite difficult at times. I know I used to feel quite down when my brothers and sisters, didn't have it. And why me? Why me? But Jacob's been brilliant. And actually, since my daughter had a daughter in October, he's not been alone, because sadly, she has the affected X chromosome. And they're both actually redheads. So we think that it might have something that might be linked in a way with the hyperphosphatemia, but whether redheadedness and X-linked hyperphosphatemia is linked, who knows. In 2013, my youngest son, Alistair, and his girlfriend had a baby boy. But as you know, it's not carried on in a Y chromosome, so his son is unaffected. And then in 2016, they had a daughter together. And as has been said, if a male passes on his X chromosome, he has the X-linked hyperphosphatemia. The daughter is inevitably going to have it. So bless her, she is going up to St Mary's now, the Children's Hospital really. And she's not actually taking the phosphate M1 alpha now, because she's currently on a clinical trial with Jacob and is going fortnightly for intramuscular injections, so I believe. Hopefully, this will be the preferred form of medication in the future, as I'm sure one injection every now and then, or whatever, is a whole lot easier than trying to get them to take 6 tablets a day. So we move on, continuing issues. Well, next year, not too far away, I'll turn 60. That's 60 years of living with hyperphosphatemia. I've been really very fortunate throughout my life, which has been quite eventful, lots of ups and downs. I have a fantastic family, 3 fabulous children, six wonderful grandchildren. I still work full-time, and I currently enjoy fairly good health. I've been on medication now, phosphate and calcium, for most of my life, apart from the little gap I had, I think, when I was in South Africa. I didn't take it. And thus have had to have regular blood tests and hospital visits. So, as with most people, as they get older, I've endured various aches and pains. A scan in 2007, I was getting some issues with my spine, and the scan showed some bony issues. But fortunately, to date, I've not had to have any intervention, and they're not causing me really too many problems. In 2015, I had to have a total knee replacement with a patella tendon repair. This gave me 3 months off work, which was great. And just recently, I've had to endure some more arthritic changes in my ankles and my arches, and my feet have dropped, which makes walking a bit more of an effort and less enjoyable. I have dogs, and I love taking them for long walks, but now if we're going over fields and around the park, I take a stick just because my ankles are a bit stiff and my feet don't bend and whatever. Quite so well. That's the beauty of getting old. And I do try to avoid standing up on my feet for long periods of time. So shopping trips are really sort of a short affair these days. Unfortunately, orthopaedic help is not available in this regard, so I've just got to get on and live with it. Since having crowns on my front teeth and my back teeth when I was pregnant, I've not really had any dental issues, thankfully. So that's really great. My daughter has a busy life. She works part-time and is now looking after 4 children, 2 of whom have hyperphosphatemia. Unfortunately, she does neglect her own condition, which upsets me a bit. I just hope she won't suffer too much in the future. My sons, however, haven't been quite as fortunate. They have been much worse affected. Stuart, he's just recently, well, last year, was diagnosed with fractures in both his femurs. So he's currently awaiting surgical intervention. I don't know whether this is referred to Dr. Khan. Hopefully it'll be sometime soon, because he's having to use crutches to get around and does have quite a lot of pain. Alistair, my youngest, and I always say if I'd had him first, I'd have stopped, because he wasn't the easiest of children. He managed to break the distal end of his tibia shortly after he'd had an osteotomy on that side, wheeling down a hill and trying to go around a corner quickly in his wheelchair and putting his foot out to stop him, and he broke the bone. So he had to have an intramedullary rod put down this tibia. Before that was done, they x-rayed his leg and they actually found that he'd got a suspected fracture in his femur, so he had to have that rodded as well. So, yep, and then whilst on holiday in Cyprus, he managed to fall and break his other femur, so he had to have that rodded. So he's quite bionic, is my youngest son. However, the rod in his tibia has been a source of infection for ages and ages. He's always on antibiotics and it just can't seem to get rid of it. So he's actually waiting to have this taken out to hopefully get rid of this infection. This, I think, itself could be quite serious and the outcome's not certain. They both continue to take medication and have regular checks, but these present issues, they do make their future uncertain. I don't know how well their mobility will be in the future. So what are my future expectations? Well, I just hope to minimise arthritic pain and joint dysfunction. I just hope it won't get to disability. Modify medication in line with new technology. I think I'd much rather have an injection every now and then and try and take phosphate and calcitriol all the time. And hopefully I'll be able to continue to work and enjoy family life to the full. And I do hope future generations are less affected. So thank you very much for listening. And I'd just like to say it's not all bad. In fact, following my last visit to clinic, I was amused to see that I've been diagnosed with excellent hyperphosphatemia. Thank you.
That's simply amazing. Simply amazing. I have learned so much about just getting your perspective, Sue. Thank you very much for sharing it with us.
You're very welcome.
Are you happy to answer some questions about your personal experience? You mentioned about. Do you want to sit down?
No, I'm fine.
No, not to study.
I'm fine.
Okay.
Are there any questions?
What was that?
No,
No questions.
that's fine.
Okay. Oh, there's one.
Okay.
Thank you, Suzanne. That was really good. I just wanted to add, it's not really a question, but I just thought it's really interesting to hear patient perspective again, because I feel that there's different priorities in the lives of people with XLH, whether that's not with a problem to doctors, but doctors see things very differently and their priorities are different compared to what patient priorities are. And I think it's important that patients need to speak up and be heard about the problems that they are having, because it's not necessarily the same things that doctors feel that they are having problems with. Thanks.
Thank you.
I think that's a very important issue, and I was just going to ask you, now reflecting back, what do you think could have been done better from our point of view, which would have made life easier from your point of view as a mother, coming to all these clinics and waiting for...
the clinic visits aren't too bad. It's the waiting around. Shall I say?
Car parking.
Well, yes, car parking could be an issue. But it is with children, sort of not getting seen on time, but then, that's any sort of hospital clinic, I guess. Now, I think I was very fortunate in having the local facility to see Dr. Jameson and not having to trek to Manchester every time, for the regular blood tests. That was a real bonus for us. So, I appreciated that. I don't know. I think it's just advancing so much that, I think new technologies hopefully will make it easier for people affected in the future. So.
Okay. Any other questions?
It was just
Mr.
out of
Khan?
interest, really, Susan. Did you have knee replacement on the side you had two osteotomies on, or at the other side?
I've had osteotomies on both tibia and both femur. So, it's just but the one knee is affected.
Any other questions? No, if not, then I would once again like to really thank you for absolutely